Hi everyone, I'm Yasser Jassam. I'm a neurologist and neuroimmunologist. Currently, I have the role as the director of the Multiple Sclerosis and Neuroimmunology Center at the Pickup Family Neuroscience Institute in Hoag Memorial Hospital. I'm excited to invite you to learn about the new initiative we have here of the HOPE Center for Multiple Sclerosis, and I'd like for all of you to have the chance to participate in the program.
Hi, my name is Audrey Johns. I'm the Pickup Family Neuroscience Multiple Sclerosis Center Nurse Navigator. Essentially, I help patients with MS and their families navigate through the course of treatment with multiple sclerosis. And I'm excited to present the MS Hope Center because it's our chance to offer patients programs that include Pilates, yoga, PT, and dietary services, and just a way to talk to each other about their experiences individually with multiple sclerosis outside of the clinic. We're excited that the Pickup Family Neuroscience Institute at Hoag Hospital is introducing a program for patients with MS specifically called the Hoag MS Hope Center. So I have to ask, why did you pick that name specifically for this center?
I think hope is important for all diseases, and especially when it's an incurable disease such as multiple sclerosis. I think hope is one of the most important weapons an MS patient can have in their armamentarium, because without hope, we truly lose a lot of potential for treatment. And this disease is a very dynamic, rapidly evolving disease. And every day we discover new treatments, avenue, and potential targets. So I think it's a very exciting time, actually, to be part of MS care. And hope is what's going to drive us through the healthcare team and also the MS patients forward. So hope, I think, is a key word in MS care.
Awesome. So I do have to ask, before your experience at Hoag Hospital, have you been involved with a program such as the MS Hope Center?
Yes, indeed. So I have been part of a very similar setup, and I've had firsthand experience about how beneficial it is for MS patients to participate in a program where there's multidisciplinary members of the team that can support them. MS patients will share their experiences, their questions, their hopes with other MS patients who might have gone through similar or different stories. And then I've seen also the end results of how these patients eventually found this program to have helped them to manage their care, and also their loved ones and the support groups who had better understanding about their symptoms and also their diseases.
So what kind of MS hot topics do you feel will be presented at these Hope Center sessions?
So for this particular questions, our program is not a fixed program. There is no rigidity in it. We will keep it as a fluid program, and we base our topics and our discussions on our patient needs. So it's a very fluid topic, and I hope that I can direct some of the discussions based on some new topics that I think might be relevant, but I truly base the vast majority of these topics on what patients would come back and tell me they'd like to hear about.
Sure. So each session is 2 hours long. Can you speak a little bit about why education pertaining to MS is so important?
So in multiple sclerosis, unfortunately, we have quite a few misconceptions. Until this very day, we see patients with multiple sclerosis that have had the disease for years, and they lack knowledge about important basics issues with multiple sclerosis care, such as subtypes of disease, what's the difference between relapsing and progressive phases, different targets for DMTs.
So why do you feel this MS Hope Center would be beneficial to the Orange County community in general?
So I always share this with my patients. I think MS falls back on the community because MS patients, they require a lot of care. They require a lot of support that would come from their family, caregivers, loved ones, friends, and also members in the society who help facilitate their cares, healthcare providers, insurance workers, drivers, different people who actually participate in the MS care team.
Finally, what would you say to someone who has MS or affected by MS that's considering joining the Hoag MS Hope Center?
I think the most important thing coming in to such a program to know that extracurricular care in MS is important. The discussion that you have with your care provider in the clinic is usually a short duration of time and it's spaced out. while the discussion can continue. What we hope for this is to have multiple healthcare providers from multiple teams and disciplines, and we can share one experience outside the clinic so we can promote for this education and this talk and this treatment to continue outside the clinic. I think that would provide a little bit of an extra arm, I would say, that would help us to manage MS in a better way.
Well, I think it's an exciting addition to the Pickup Family Neuroscience Institute, and we look forward to hearing more about it in the future.
I'm excited about it as well. Thank you so much for having me.